Hi, I'm Chris with the New Mexico Aging and Long-Term Services Department State Health Insurance Assistance Program. And I'm here today to go through a quick tutorial on how to use the Medicare Plan Finder for prescription drugs during this Medicare open enrollment season. So without further ado, we're going to go to Medicare.Gov and dive right in. So the first thing that I want to make sure I mention is that you do not want to Google Medicare. Holy cow. It's like opening Pandora's box. Instead, go up to the actual address window at the top of your screen, whatever browser you're using, and type in Medicare.gov. You'll go straight to the official Medicare website. You know it's the official Medicare website because there's a little American flag here, and it says an official website of the United States government. And now you know what to expect. You know to expect a happy, healthy, gray-haired person giving you some good vibes about how to get your Medicare care in 2024. So we're going to go to the blue Find Plans in the upper left-hand corner here. And this is where we're going to see the plans that are going to be available in 2024. So let's click on this. You can create an account on Medicare.gov and log in. It's a great thing to do. It's as safe as anything can be on the internet. They work really hard to make sure that that it's safe for you. But you can also continue without logging in, and that's what we're going to do today. So we're going to be looking at plans for 2024. If you're actually turning 65 in October, November, or December, you may need to look at 2023 plans, and you can just switch to looking at this year's plans by clicking right here. But right now, we're going to just look at next year's plans. And I'm just going to pick an Albuquerque zip code 87121 just for fun. Click on Continue. This tutorial is on how to search for Medicare Part D or prescription drug plans. So I'm going to select that. And then it asks if you get any assistance, because that can impact your costs. For today's tutorial, I'm just going to click on I'm not sure. And then we're going to continue without logging in. You could log in at this point if you've created an account, but you don't have to. So I'm going to click on continue without logging in. You always want to put in you want to look at your prescription drug costs. That's for most people, that's their main monthly health costs. So unless the only reason you'd put no is if you don't take any prescription medications, but if you take anything at all, you want to click yes. And then we're going to enter in the drugs. This is the most time-consuming part of the whole process. Let's put in Januvia. That is a common insulin drug. The next thing you're going to do is you're going to have to put in the dosage, and it's really important that you put in the correct dosage. In this case, I'm just going to stick with the default, which is a 100 milligram tablet once a day, or quantity 30 per month. I'm going to add that to the list. We're going to put another one in here. We're going to choose metformin. You can see here that there are multiple metformins. There's metformin in combination with various other drugs, and then there's metformin hydrochloride. Each of these is potentially covered very differently by a plan's formulary, so you want to make sure that you have the exact medication that you take. In this case, I'm going to select the metformin hydrochloride. I'm going to click on Add Drug. And again, so important to know exactly what the dosage is. In this case, this drug comes in a solution, a tablet, and an extended release tablet. Okay, so they're each, again, the costs are going to be different depending on which of these you take. So I'm going to go to this 500 milligram extended release. And let's say this is, this is something that it looks like is taken 4 times a day. So I'm going to add it to the drug list. I'm going to add a common blood pressure medication. And you can see that it starts to, as soon as you start typing, it starts to anticipate what you might be looking for. So I'm going to go with metoprolol. Now there's two metoprolols here, tartrate and succinate. So it's really important to know which one you take, because again, one may or may not be on the formulary for the plans that you look at, and the cost may vary. I'm going to choose that one. And then again, with this one, they're all extended release. We're going to add that to the drug list, and we're going to do one more. Let's do a common cholesterol medication, atorvastatin. Put that one in. Let's say we're in pretty good shape. We're only taking the 10 milligram once a day. There we go. So now we've added the 4 medications in here, and we're done adding drugs. You'll add all of the prescription medications that you take in this area. You over-the-counter medications, vitamins, supplements, even if your doctor has told you that you need to take them, they don't get entered into the Plan Finder because they're not covered under formularies. They're over the counter. So now we're done adding the drugs. The next thing that we need to do is choose our pharmacies. You can put in up to 5 pharmacies. I highly recommend filling all 5 pharmacy slots. And even if you think you don't want mail order, I always include that in the comparison because it's really interesting to see how your costs can differ depending on where you pick up your medications. Sometimes mail order can be significantly less, but not always. So let's click mail order because we just want to look and see what it's going to cost. Let's click the Walgreens, Walmart. I always ask people where they go grocery shopping because sometimes the grocery stores like Smith's or Albertsons can have very good prices. And then let's put CVS in here too. And that is 5. So you can see they're listed down here along the bottom, and I am going to click done. And now we're into looking at the plans. Okay, so here's an interesting feature. You can, if you are not sure whether you want to stay with original Medicare, just change your drug plan, or if you want to switch over to a Medicare Advantage plan, you can easily change the type of plan you're looking at by clicking under plan type without having to re-enter your medications. So that's kind of a nice feature. We're not going to do that today. The plans are sorted by lowest drug and premium cost, the one that's going to cost you the least amount per month. And you can also sort by insurance carrier, right? If you know you want to look at a particular insurance company's plans, you can just select for those here. I'm not going to do that today. There are 22 drug plans available in this zip code. The first one that comes up is a WellCare Value Script PDP or prescription drug plan. The star rating is here. It has 3.5 stars. All 4 of the pharmacies that we selected are in network. I'm wondering if maybe all of the drugs aren't in network. This plan has a 50 cents per month monthly premium. That's pretty low. It also has a $545 deductible. If you get your drugs at a retail pharmacy for the entire year, so to get an idea of your cost per month, your co-pays per month, you divide that by 12 and about $1,000 for mail order. So in this case, mail order is actually more expensive. Let's take a look at the plan details and I'll show you how to figure out where those costs come from. So we never ever want to select a plan without looking at the details. This blue plan details bar is what we click on. All right, so now we see the actual plan ID here. And underneath that there's a link to the plan website, and there's phone numbers to call. So if you don't have a WellCare plan right now, you'd call this non-member number. If you do have a different WellCare policy, you would call the member number. So we can see that all 4 of the drugs are on the formulary because it says here covers 4 of 4 drugs. Okay. So let's go see why they cost so much. So here again, it shows that there's a 50 cents per month monthly premium. The drug deductible is $545. That's the maximum allowed deductible for 2024. You can click here anytime you see something that's underlined or blue. That means there's a link and you can click on it. In this case, if we click on this, it takes us to a different website, takes us to a different part of Medicare.Gov, and gives us some information about extra help and how to apply for that. If you call us here at the Aging and Disability Resource Center or go to one of the events and meet with one of our SHIP counselors in person, we'll screen you for these programs as well. All right, so I'm going to go out of that. So we can see that with this plan, this particular prescription drug plan, Smith's, CVS, and Walgreens and mail order are all preferred in network pharmacies, and Walmart is just in network, it's not preferred. So that usually has an impact on the cost. So boy howdy does it ever in this case. So for the atorvastatin, if you picked it up at Smith's, your copay would be 76 cents. At CVS, it would be 29 cents. At Walgreens, it would be 0. But at Walmart, you'd pay $54. Holy cow. So you can see that it's really important to look at different pharmacies and see what their network status is with any particular plan, because it can have a really big impact on your costs. And it may be worth it to change from your usual pharmacy if it's not preferred, or if it's out of network, in which case costs go up even more. Oh, it is the Januvia that is the big problem here. Right? It is expensive. Holy Moses. Okay. This cost is for the entire year. Okay. This is not per month. So we're going to take a look in a sec about what these things are going to cost per month. The next section of the Plan Finder details here are the estimated total drug and premium costs. So for the entire year, if with the medications that we put in, this would be your total copay for the entire year. You'll meet the deductible in February with everything except mail order, which is January. You'll enter the coverage gap in November if you pick up your drugs at Smith's or CVS. If you go to Walgreens, you won't enter the coverage gap at all. And if you go to Walmart or mail order, you'll enter the coverage gap in October. So you can see there are really big differences depending on which pharmacy you use. What is the coverage gap? What does that mean? Well, we can click on this because it's underlined and it'll tell us. Also called the donut hole, you'll pay no more than 25% for covered drugs during the coverage gap, but the full price will count towards getting out of the coverage gap. But with the medications we put in, it says here that we won't get out of the coverage gap in 2024. So what does that mean for your monthly cost? What's it going to cost you when you pick up your drugs every month? Well, January is the month that you're meeting your deductible, and we saw that Januvia is expensive. So January is going to be painful. It seems like Walgreens would be the best place to pick up your medicine from this plan, and it would cost you $400. in January. But in February, your copay goes down to $166. And then for the rest of the year, your copays, and this is your total copay for all the medications, they go down to $16 a month. That's not terrible. With the other plans where you exit the coverage gap, you can see that your copays go up again. But with the Walgreens, you don't get out of the coverage gap, and so your costs stay lower, right? So it's really interesting. We can find out more about how that whole process works by clicking on the plus in this estimated cost during coverage phases section. So the first thing I want to look at is Walgreens, because that seems like it has the best prices. So I'm going to click on that. And it tells us right here, atorvastatin, the retail cost is $1.26. Before the deductible, it costs $0. After the deductible, it costs $0. If you go in the coverage gap, you start having a 32-cent copay. And after you exit the coverage gap, it goes back down to $0. Januvia, the retail cost is $394.86. Before the deductible, you pay the full price. After you've met the deductible, it goes down to $11, but in the coverage gap, you have to pay 25%. So your copay goes up to almost $100, $98.72. Metformin, that's a cheap one, $4.26. Before and after the deductible, it's $0. In the coverage gap, your copay goes up to $1.07. The metoprolol, same thing, $16.86 is the retail cost. That's not what you're paying. Before the deductible, you're going to pay $5. After the deductible, it's still $5. In the coverage gap, it goes down to $4.22. So this gives you an idea of what it's going to cost. Let's look at Walmart too, just for comparison. And again, you see the retail cost, $8.27. The retail cost for atorvastatin at Walmart is higher than the retail cost for atorvastatin at Walgreens. Each pharmacy negotiates the prices with its suppliers, and so there can be differences, okay? Same thing here, the Januvia. At Walmart, the price they've negotiated for Januvia with their suppliers is $473.72. But Walgreens made a better deal. They're getting it for $394.86. So the drug costs can vary depending on where you pick them up. Okay? It's really important to kind of be aware of that. All right, the next thing that we can look at, if we, again, anytime you see a plus, expand that out. This last bar shows us the cost by drug tier. So sometimes people want to know, what tier are my drugs? Do they require prior authorization? Are there quantity limits? Is step therapy covered? All that information is here in that last section. Okay, and then there's the star ratings. You can go, I'm going to go back to the very top of the plan details by clicking on Overview. And that's going to take me back to the top so I don't have to scroll all the way back up and make my wrist tired. I'm going to scroll up a little bit more and go back to Search Results. And that's going to take me back to the rest of the plan. So that WellCare plan, that might be interesting. I'm going to click, you can also, another nice thing that you can do here is you can do a side-by-side comparison. So I'm going to add that to the compare. Here's another WellCare. It is, now look at this. This first WellCare had a 50-cent a month premium, and it estimated your drug and premium cost for the entire year would be $732 if you picked it up at a retail pharmacy, or just over $1,000 at mail order. This plan has a $32.40 a month premium. So you're going to be paying a lot more for it just to have it for every month. And then your costs are also higher. So it doesn't cover the drugs quite as well. Every plan and every person is individual. So how a plan covers any particular combination of drugs is going to vary. You cannot assume if you're a husband and wife, or you and your sister are looking at these together, you can't assume just because you put your medications in that it's going to be the same cost profile for someone else. You really have to each do your own. The WellCare has a whole bunch of plans. Let's look at this Cigna one, just to look at something different. It has a low monthly premium, but holy cow, it costs a lot more for your medications. Well, let's take a look anyway. So we're going to click on the plan details. For this one, all 4 drugs are covered. That has that $9.80 monthly premium, the same drug deductible of $545. In this one, Smith's is out of network, so we probably really don't want to get our drugs there. CVS is in network, and Walgreens, Walmart, and mail order are all preferred. So you can see, holy Moses, again, you do not want to go to Smith's because atorvastatin would cost you over $1,000 a year. Whereas if you go to Walgreens, it's going to cost you 69 cents for the entire year. So you really need to pay attention to whether your pharmacy is a preferred in-network pharmacy, in-network, or out-of-network. That can have a really big impact on your costs. Look at the Januvia. If you go out of network, it's going to cost you over almost $8,000 a year. Whereas in-network, it's a lot less. It's still expensive, but it's a lot less. So let's go down here and take a look. Again, with this plan, you'll meet the deductible in February, except for mail order that's met in January. You'll enter the coverage gap if you go out of network in July, but October or November, October for this CVS in network, October or November if you go to one of the preferred pharmacies. And then for everybody except the out-of-network pharmacy, you'll stay in the coverage gap for the rest of the year. And these are the monthly copays that you can expect when you go to pick up your medication. So for January, when you're meeting that $545 deductible, your drugs are going to cost you more. You're going to have higher copays. But then they go down in February. If you go to one of the preferred pharmacies, Walgreens or Walmart, your copays, which is still a lot, it's going to be $168. Then it goes down to $83 for the rest of the year until you exit the coverage gap. And then your costs go up a little bit. And again, we can see why exactly that happens and what exactly you can expect by clicking on the plus and expanding this out. So I'm going to pick one of the preferred in-network pharmacies because I know if I pick this plan, I know I'm going to need to go to Walgreens or Walmart. So the atorvastatin has a retail cost of $2.76. In the coverage gap, your copay is actually going to go up because you have to pay 25%, but then it's zero after you exit the coverage gap. The same thing for your Januvia. That's why your costs go up for those last 2 months of the year, because once you get in the coverage gap, you have to pay 25%. Okay? And just again, because it always makes me so curious. So you can see that Walgreens negotiated much better prices with their producers, their drug producers. Atorvastatin, the retail cost for atorvastatin at Walmart is $10.45, but Walgreens is only paying $2.76. So this impacts your copays, right? When you get, so In the coverage gap, at Walgreens, it's 69 cents. At Walmart, it's $2.61. Right? This is why. Alrighty then. So I'm going to go back to the top by clicking on Overview and scroll back over here. This has just been a quick tutorial to show you where to find some of the information you're going to need when you're considering plans using the Medicare Plan Finder. And again, to just reiterate really quickly, you always want to make sure you look at the full plan details. Anytime there's something that you can click on, a plus sign, an underlined area, click on it. If you find that you've been looking at plans and it's as clear as mud and you really want some help from an unbiased expert, give us a call. You can call the ADRC at 1-800-432-2080. We are doing phone appointments throughout the Medicare open enrollment period where we can help you go through the plans and just help you assess which one might best meet your needs. Again, the SHIP program stands for State Health Insurance Assistance Program. We don't sell or endorse any insurance policies. We're just here to help you navigate this crazy time and make sure that you really have the insurance that's going to work best for you. You know where to get the information you need to make that choice. We also have a series of in-person counseling events throughout the state. We have over 100 in-person events scheduled. To find out where the closest event to you is and when you might see one of our SHIP counselors in person in your area, you can call the ADRC at 1-800-432-2080 and they'll be able to let you know. So happy hunting during Medicare. Again, if you need assistance, if you get overwhelmed and you just want to talk to somebody before you make a final decision, we are here for you. Your New Mexico SHIP program is happy to help. Thank you.